This video will show you how to properly change your medication bag on the Eitan Medical Sapphire pump. Please follow all instructions shown in this video. Administering home IV medication on the Sapphire pump can be safe and easy with proper instruction. Your home health nurse will be available to instruct you on the procedure following discharge and will visit weekly and as needed for your catheter dressing change and any labs that your doctor has ordered. If your medication is refrigerated, remove it from the refrigerator 2 to 6 hours before administering, as instructed on your medication prescription label. Place the bag of medication on a clean, dry surface and warm to room temperature. Please begin by preparing your work surface by cleaning the area thoroughly with soap and water, or a disinfectant wipe, and drying thoroughly as well. Wash your hands for at least 20 seconds, and then dry your hands. Use a separate towel to turn the faucet off. Gather your IV medication bag as your tubing is not changed daily. Your pharmacy and healthcare professional will instruct you on how often your tubing should be changed. Contact your pharmacy at the phone number located at the top of the medication prescription label with any questions. Check the medication prescription label on your medication bag for the correct patient name, expiration date, drug, and frequency. Inspect the bag of medication for any leaks or particulate matter. If you find any abnormalities in your medication bag or label, contact your pharmacy at the phone number located on the top of the medication prescription label. Stop infusion by pressing the Stop button. Then press Quit, and then Quit Infusion on the home screen to fully stop. Close the clamp on the tubing as shown. Remove the protective tab from entry port of the new medication bag. Remove the spike from the existing medication bag and insert into the new medication bag using a pushing, twisting motion. Do not touch the spike. To start your medication dose, press Repeat Last Infusion. When you press Repeat Last Infusion, your pump will either display the pump's settings or displays the No symbol and reads, Air detection is set to off. If your screen displays the No symbol and reads, Air detection is set to off, use a set with air eliminating filter, you must verify your tubing has an inline filter. All Sapphire inline filters like this one are air eliminating and will not allow air to pass through the filter to your IV catheter. If your pump has this alert and your tubing does not have an inline filter, do not start your medication dose and call your pharmacy at the number listed on the top of your medication prescription label. Once you have confirmed your tubing has an inline filter, press OK. When the pump parameters show on the pump screen, compare them to the medication prescription label infusion parameters. Contact your pharmacy if the pump and medication label do not match. Your pharmacy phone number will be on the top of the medication label. If the pump settings are correct, you will press OK. Please double-check that all the clamps on your tubing are open and press Start Infusion. The display screen may enter a screensaver mode with a dimmer screen showing the rate, or the screen may turn off while running. If this occurs, the green light on the sidebar will blink to indicate that the pump is still running. You can press the on-off button if it has gone dark. If your medication is not attached to an IV pole and you have a pouch or a backpack, you can now place your medication bag and pump inside the bag during your infusion. Should an alarm display during your infusion, you must press Mute at the bottom of the screen before clearing the alarm. After the cause of the alarm is corrected, press OK to dismiss it, then press Request Continue, followed by OK to resume your infusion. All IV supplies are single-use only and should be disposed of after one use. Wash your hands for at least 20 seconds, and then dry your hands. Use a separate towel to turn the faucet off. Proper administration of your medication via the Eitan Medical Sapphire pump at home is important for your safety. Please call your pharmacy if you have any questions or concerns while administering your medication. We are available 24 hours a day, 7 days a week. In the event of an emergency, always call 911.